Hello everyone, I am Dr. RFD again, and today with me, this is another exciting day with one of our main Smile Ambassador, Lharby Policarpio.
Hi everybody!
He's with me today because we'll be doing laser teeth whitening with our new machine. This machine is one of the newest laser teeth whitening machine that we have in the clinic because it has the capacity to change the temperature of the laser. It can be cold or it can be hot. Kasi syempre kung malamig or mainit, may effect yan sa pagiging maputi ng ipin. So this is one of the latest machine in urban that I'll be using for Lharby for today's dental procedure. As well as, of course, we have a new stain remover machine. Syempre, if you drink soda, coffee, tea, coffee drinker si Lharby. So I recommend na pwedeng natin gamitin ito sa mga patients as well as kay Lharby at least every 4 to 6 months. So this is what we call high flow, airflow stain remover machine. The difference with the other machine outside is it has sodium bicarbonate with salt, of course. Yung component nito is siya mismo magtatanggal ng stain. May kita mo siya usually kapag sobrang heavy at may mga nicotine stain sa teeth. May kita mo na mawawala talaga siya in few seconds lang. Mabilis.
Oh, nice. So, the question, is it like a whitening machine na din ba? Parang gano'n?
Mayroong partly because the stains were removed. But of course, the capacity to whiten the teeth from 3 to 5 shades lighter sa laser teeth whitening machine lang siya pwedeng ma-achieve. It's because of another component ng ating teeth whitening solution. It has what we call hydrogen peroxide. So, we usually use 10 to 12% of hydrogen peroxide sa laser teeth whitening system natin because that's the one recommended by, of course, American Dental Association. By the way, there's one interesting thing na gagawin natin kay Lharby. It's because kasi Lharby currently is wearing clear aligners. So that's an invisible and removable braces that we have in Urban. We have our own brand, exclusively for Urban lang dito sa Philippines. So the good thing about wearing clear aligners is that you can have teeth whitening at least every 6 months pa din. Unlike all other type of braces like metallic, ceramics, and sapphire, yung mga fixed braces, hindi ka makakapag teeth whitening. So pag may clear aligners ka, just like Lharby, tatanggalin mo lang yon, then your dentist can actually do the laser teeth whitening. Ayun. So with that, since mag-umpisa na tayo ng procedure, pwede nang tanggalin ni Lharby yung kanyang clear aligners, upper and lower.
Sobrang dali lang yan tanggalin. Na-master ko na siya actually. So, syempre. There you go. So, I just remove it whenever I eat or drink. Kasi, syempre, para hindi magka-stain yung ano, diba? Okay. Actually, merong kasama to na pangtanggal, pero di ko masyadong ginagamit kasi gusto ko mabilis. So,
kahit ako man, mas gusto ko na ano. Kasi yung pantanggal mas...
naman yun, diba?
Yeah, oo. Okay, start na tayo.
Ang maganda sa kanya kasi, ang differences ng traditional braces dito, ang pinaka nagustuhan ko is that it's really not painful. Siguro parang, alam mo yung typical na masakit lang yung ipin mo, pero tolerable. Tapos, habang tumatagal, syempre, di ba yung pain, parang nagre-reset siya every time you change the aligners, new aligners. Pero parang after 3 days, okay na siya.
Okay na ulit.
Parang you'll get used to the small pain na lang hanggang sa eventually maging wala na siya. Ang ibig sabihin ba nun kapag nawala na yung pain, okay na siya? Ibig sabihin naka-move na yung ipin? Or nagmo-move pa din yun unti-unti kahit nawala?
Nagmo-move pa rin. By the book, usually every second nagmo-move ang teeth. Pero syempre, there's what they call process of deposition and resorption. Deposition and resorption, ibig sabihin, from this area na lumipat yung teeth, nag-move siya, nawawalan doon ng bone.
Okay.
Yung pupuntahan niya, nagkakaroon ng bone. So, yung process na yon, usually, that's why kahit traditional braces, 2 to 3 weeks yung adjustment. Kailangan ng bone ng teeth ng 2 to 3 weeks bago siya ma-relax. So, yung 3 days, mawawala na talaga yung pain. Pero usually, yung movement niya, mamimit na niya yan usually on the 3rd week. Kaya mga naka-fixed braces, monthly yung adjustment.
Oo nga, monthly.
Sa yung removable, we change it every 2 weeks, right?
2 weeks.
2 weeks. Depending on the design. Kasi meron din kaming sariling brand na weekly naman yung change. Oo. You were talking about the pain. Hindi talaga masyadong masakit ng clear aligners kasi ang nanogram of pain na binibigay niya is around 100 to 150.
Sa aligners?
The fixed one, the metallic, the sapphire, and the ceramics, the fixed brace, usually 350 to 500 nanogram of force. Ito kasi mga 150 lang to 200. That's the good thing about that. Walang mouth sores, yes. Kasi syempre, ang metallic braces, sapphire, and ceramics, yung mga fixed braces, or even lingual, yung braces at the back of the teeth. Yung braces at the back of the teeth, yung lingual, ang effect nun, tongue sores. So maraming...
Ay, oo, yung lingual.
Yun namang mga braces in front of the teeth, may mouth sore siya sa gilag, sa lips, ganyan. Yun yung naging problem because of the friction. That's why sa Urban, meron kaming magandang material, SWLF, straight wire, low friction braces. Hindi nagkukos ng sobrang mouth sores. But of course, hindi mo siya mako-compare sa clear aligner. Wala talaga yan. Kasi it is just really overlying the teeth surfaces, wala yung contact sa gums.
Yeah, and tingnan nyo guys, as in, talagang typical na para lang siyang plastic na nakapatong sa ipin mo. And syempre, yung sides niya, hindi kasi siya matulis so hindi ka talaga masusugatan.
The material is polyethylene, so yun yun.
Yun yung kind ng material.
So ano yan, sobrang hindi yan basta-basta masisira. Kaya nga pinapalitan din siya every 2 weeks kasi syempre, after 2 weeks, na-meet niya na yung purpose sa teeth ni Lharby. So pang 20 niya, so kasi pang 20 sets niya na yun. So,
pero hindi actually, when it comes to pain, hindi naman talaga siya painful talaga na as in pain na katulad ng mga traditional braces. This is really way different from that. And tawag dito, sobrang as in comfortability wise, sobrang legit, as in ang bilis. Parang siguro dahil nga ikaw yung may hawak ng pag-change mo ng aligners, parang nakikita mo na din sort of yung result. Nakikita mo agad. Tapos ako, hilig ko pa mag-take ng photo. So nakikita ko yung difference.
Kahit sa upper set of teeth mo
Oo, from
mas
before
maganda
sa ngayon. As in, ang layo ng difference niya talaga.
So before we start the laser teeth whitening procedure, we'll be doing a smile light photo so that we can compare ano yung before and after, ilang shades yung naging maputi yung teeth ni Lharby. Mark. So since si Lharby andito rin, so gagamitin din natin sa kanyang bagong mouth retractor. The good thing about this mouth retractor or cheek retractor.
Parang robot
The good thing about that apparatus is that meron siyang sariling suction na tube so that magsasuction na siya ng laway later. Yan. Can you bite? Yun. Bago siya, no? Hindi mo rin nagamit before, no? Ayan.
Oh, God.
Then we're going to attach it to the main suction system. Yes. There you go. Then it will now automatically suction all the saliva drizzle inside the mouth. Ganun na. Then we'll be using the anti-sensitivity solution. So Lharby won't feel any sensitivity during the process. Syempre, disclaimer, teeth whitening system can only whiten the natural teeth surface. So just in case the patient is wearing something artificial in the mouth, hindi yun pumuputi. So natural teeth lang talaga ang pumuputi. These attachments, syempre hindi siya puputi. If the patient is wearing veneers, hindi na yung puputi. Natural teeth lang ang pumuputi. Yan. So waiting. Mix na natin. Make sure after the desensitizer were placed and removed, we can now put on the gum protector, gum barrier. Now we'll be putting on the machine. I'll start with 40 degrees Celsius. We'll just change the solution every 15 minutes. Usually during the first cycle of laser teeth whitening, you would see an instant result. Usually around 1 to 2 shades lighter. So we only did one cycle pa lang, and I'll be preparing his teeth for the second cycle. Most patients, usually meron silang sensitivity or pain. May na-feel ka ba ngayon? Oh, wala. Alright, so we'll start with the second cycle. If you can come closer, makikita mo na maputi na talaga siya. Without light. And with light. Puti na, no? Sige. Lagyan na natin. Ulit. So we'll be placing him again under the laser teeth whitening machine. Alright. There you go. Start. Yan. So for the viewers, what are the do's and don'ts for laser teeth whitening? So immediately after the procedure, after removing the gum barrier, I have to clean the teeth again, and I'll be putting on a teeth desensitizer. Gumagamit kami usually ng tooth mousse. But of course, you have to understand that after teeth whitening, may mga bawal na gawin. So what are those? You cannot consume anything that is colored, say Royal, Coke, things like mga drinks na may color, sauces, mustard, hard ketchup should not be taken in the next 3 to 5 days. So, ang pwedeng mga kainin, usually mga white and clear. Pwede kang say, fried chicken, pwede yan. Carbonara, pwede. Red spaghetti, bawal yan kasi because of the red sauce, no? So, some patients would feel sensitivity. So, dapat pwede silang mag-pain reliever. So, depending on the sensitivity na meron ka, you can take any over-the-counter pain reliever, no? But of course, if you can tolerate, pwede naman. Remember, the science behind teeth whitening, peroxide content usually dries up the teeth. Kapag nag-dry siya, namumuti siya. Kaya, yun yung effect ng laser teeth whitening. Whatever brand it is, yun yung effect niya. Dinadry niya siya. So, once it's dry, it's sensitive. So, that's why ang una dapat magka-come into contact with the teeth after the procedure should be white. That's why gumagamit kami ng tooth mousse. Alright? So, sometimes then, after the procedure, you would see some white marks or white spots over your gum area. Ang tawag doon, gum burn because of the peroxide. Hindi naman siya dapat ikabahala because that can still be removed in a few minutes to hours. Once we wash it with water, nawawala din naman siya. Ang dapat lang gawin ng patient whenever you see white spots over the gum surfaces after laser teeth whitening is that you just have to avoid touching the area with your tongue kasi may irritate mo yon. But usually after a few hours or minsan minutes lang, wala na siya. Yan lang. So, those are the do's and don'ts. Usually, indicated po ang laser teeth whitening to patients who are heavy smoker because of nicotine stains. For those patients with drinking a lot of tea, soda, wine, coffee, yun talaga yung purpose niyan. Most frequently asked questions, gaano kadalas siya pwedeng gawin? Usually once or twice a year lang siya pwedeng gawin because of course the sensitivity of your enamel na pwedeng mangyari. So usually ginagawa yun once or twice a year lang. So we're back and this is our last session for Lharby's laser teeth whitening. We're going to remove the whitening solution. Alright? Open. Closer, Mark. Yan. Wala naman sa lips. I'm just going to remove the gum barrier. Puti na. Sobrang bilis na magtanggal ng gum barrier. Puti. Bilis lang. Yeah, magpipicture tayo. Puti naman. Check mo nga. BL4. Pa. Tama. Bleach 4. So we started the teeth whitening session with Lharby with A3 shade. Now, from A3 it became BL4 or bleach 4. Yan. So, in just A3 to BL4 or nearly BL3. Usually mga 1, 2, 3, 4. 4 shades lighter.
Can I take a photo of that?
Yeah. There. Yun. So, maglalagay lang tayo na, we'll be putting on this tooth mousse, as I've mentioned. Mabilis lang.
Alright. Can I remove this now?
Yeah,
Oh my god, I see colors!
By the way, kasi as I've mentioned, ma-appreciate mo siya kapag natural teeth, ha? So, yung ibang part, syempre, because of some other procedures done inside the mouth of Lharby, hindi lahat pare-pares yung color. Okay? Mag-tooth mousse muna tayo.
So what's that for?
For sensitivity. Kasi dry yung teeth after, eh.
Okay.
So, this one will moisturize the teeth.
In all fairness, I didn't feel any pain. Promise.
Well, the good thing about this is, syempre, the first, as I mentioned a while ago, the first material that should come into contact with the teeth after the procedure should be white para mas maintained. Mas puti pa yung ipin in the next few days for as long as you follow the instruction of not taking anything that is colored. Sauces, coffee, bawal muna.
Ang pag-whitening ng teeth, hanggang ilang session ang kaya ng isang patient?
Ako kasi when I do, ideally 2 to 3 cycles lang per sitting. Pero may patient kasi gusto nila maputing-maputi. Kaya naman kahit mga 4 or 5. Kasi ang tagal nun. Tsaka syempre yung naka-open yung mouth nila na matagal. Pero ang puti nun. So yung mga food na pwede mo lang kainin, yun nga, alam mo na, the usual. Clear and white. So mga fried pwede. Oo. Carbonara pwede.
So kapag nag-chicken ka, bawal yung gravy.
Bawal ang gravy. Pero pwede mag-fried chicken. Baka kasi sabihin ng iba, yung mga fried pwede syempre. Steam pwede. Basta walang sauce. Yung mga sauces yung nagkukos ng discoloration sa teeth or stains. Kaya kay Lharby, naglagay na ako agad ng tooth mo sa color white para na-coat na yung ipin.
Yes. Actually, lasa siyang toothpaste.
Yeah, tooth mousse. Ganun siya. May mga flavor yan. Vanilla, strawberry, melon. Yan. We're inviting all the patients out there who would want to have laser teeth whitening. It's available in all of the branches of Urban Smiles in Metro Manila. Currently, we have 9 branches.
Sorry, meron akong question.
Yes.
Kapag nagpa-teeth whitening, is it super expensive?
Okay. Not really. Not really. But usually, I charge 15,000 per cycle.
The reason why I ask kasi, especially this is a message to those who are watching this. Kasi usually yung teeth whitening sa ibang tao kasi akala nila it's super expensive, that's why hindi nila ina-avail or they never ask about it. But it's not really that expensive. And especially lalo na kung as in naman yung gagawa. Like for example, of course, Urban Smiles. Ako, personally, my own experience right now, after this, I didn't feel any pain. It's painless and though of course may mga precautions naman siya, may mga sinabi naman si Doc na may possibilities na may ngilo, ganyan. But it's also part of, it's really part of the process of having your teeth na i-bleach or i-whiten. And tawag dito, sana yung mga taong laging mahilig mag-coffee, kasi yun eh, ako problem ko talaga yan, sobrang hilig ko mag-coffee. Like, I drink coffee 4 to 5 times a day. And problema ko talaga na mabilis mag-yellowish yung teeth ko.
Tapos black pa, black coffee.
Oo, black coffee pa ako.
Nakita ko sa story niya, black talaga eh. Ay kasi mababa ang calories. Mababa ang calories.
Saka dito, kapag nag-diet ka talaga. You should inquire sa Urban Smiles kasi sobrang helpful nun, especially kung lagi kayo may kumain or uminom ng coffee or kumain ng mga laging may kulay na pagkain.
Yeah. Well, that's an alternative. Laser teeth whitening is an alternative but it is never permanent. Kasi they always ask na maputi na ba yan ang buong buhay nila? Siyempre hindi. If you would want your teeth to be really whitened in the next 10-20 years, then Veneers. Veneers is for you. Mamimili ka na niyan if you would want ceramide, porcelain emax, zirconia.
Madami, iba-iba pala.
Madami, yes. Depending, of course, budget din. And of course, depending on the durability and the goal of the patient, kung ano gusto mong ipagawa. But most of the time, if you would want talaga na maputi yung ipin mo in the next 10-20 years, veneers yun. Other than that, veneers can change the size and shape of the teeth. Siyempre, teeth whitening will only change the shade, di ba? Can be whiter. After, mga 3 to 5 shades lighter after the procedure. Pero kapag veneers, lahat talaga pwede. Pati anatomy, shape, size, pwede kung pahabain, paliitin.
Okay. Pero mababawasan yun, di ba?
Yes, there's a little reduction depending on the type of veneers. Kasi there's direct veneers and there's indirect veneers. Kapag direct, chair side, pagdating ni Lharby, gagawin na agad. Walang reduction yon. Pero pag indirect veneer, I have to reduce a little. We'll send it to the laboratory. They will fabricate it. Then ikakabit ko sa patient's trial fitting. Then saka ko siya ikakabit. Yan.
Okay.
That's another episode.
Yes.
Siguro after ni Lharby, after clear aligners, if you would want to have veneers, of course, pwede.
Yes, guys. So alam niyo na, if you guys have teeth problems, saan pa kayo pupunta? Urban Smiles.
Yes.
Forever Urban Smiles.
Thank you everyone for watching our today's episode of Laser Teeth Whitening with Lharby Policarpio. Of course, you can follow him on his IG.
Yes, you can follow me on my Instagram account. It's I am Larb, especially on Facebook. Of course, it's Lharby Policarpio. You may check. So, alam niyo na yan, guys. Thank you so much.
Yes, and I have my Facebook and Instagram account too, Dr. RFD for Facebook account. And for my IG, it's Dr. RFD pa rin. And my YouTube account is Smile with Dr. RFD. Okay,
and guys, Urban Smiles Instagram handle, please do follow. Kasi minsan nagpo-post sila ng mga promos and mga free consultations. So alam niyo na, follow niyo yan.
Yes. Okay. Thank you everyone for watching.